is Brian. I'm an N3 student and I'm going to be performing tracheostomy suction. For this skill, I'm going to need my equipment, which is right here, and my PPE. For this skill, I also want to mention my table is going to be my sterile field. Everything is going to be waist level, and I need to sanitize it before I set up my equipment. My patient today is going to be Jerry Brown. He was born on 11/11/11, and he has no allergies. Okay, before I begin, I do want to mention, I think I'm left-handed, so I'm going to be on the left side of the patient's bed. And I also have an obturator on the patient's bedside. Okay, so I'm ready to begin. Hello, my name is Brian. I'm going to be your nurse for today. And today I'm just going to be performing some tracheostomy suction. Before I begin, hand hygiene. Can I go ahead and just see your armband and verify your name and date of birth? He tells me his name, it's correct. Tells me his birthday, it's correct. Okay, Mr. Brown, do you have any allergies? He has no allergies? Okay, great. Again, I'm going to be performing tracheostomy suctioning. The purpose of this skill is to suction some mucus in your windpipe. This is due because we have a doctor's order or because you have an ineffective cough. We're hoping once I'm finished suctioning off the mucus, you can breathe better, cough more better, and your oxygen levels will rise. Any questions for me? No questions? Okay, great. So before I begin, I want to go ahead and put on my gloves. And I want to go ahead and grab a set of vitals and place a continuous pulse ox on my patient. There you go. Set of vitals, blood pressure, respirations per minute, heart rate, all that great stuff. I'm going to get my lung sound assessments. Get some lung sounds before I suction, anterior and posterior. Sorry about that, I got stuck. There you go, anterior and posterior. And I want to make sure my equipment is functioning correctly, my suctioning equipment. Set it at the correct range at 80 to 120 millimeters of hydrogen. Place it on his bedside and go ahead and place him in high Fowler's position, raise him on my waist level. Make sure the obturator is nearby on the bed. And I'm ready to begin my skill. I'm going to place this right here. With my gloves and hygiene. Put on my mask. Now I'm going to go ahead and start setting up my sterile field, sanitize, let it air dry, grab my sterile saline water, and go ahead and start. Open up my equipment. Open up the sterile water, sterile saline. Pop open the cup, and the only thing that's sterile should be the inside. So there we go. And nothing's sterile right there. In case I did touch it, I'm going to go ahead and replace it and start my sterile field again, but I didn't touch it, so I'm going to go ahead. Okay, let's assume I did touch it, so I'm going to go ahead and get a new kit, do it again, sterilely place it like this. The only thing that needs to be sterile is inside the cup for the saline. There we go. And I'm going to go ahead and hyperoxygenate my patient for 1 minute. Hand hygiene. Do this again. Since my hand is a sterile glove, I can go ahead and freely move this around how I want. Sterile to sterile. There we go. I can worry about fixing that later once I have both my sterile gloves. So, as you can see, there we go. Just fix that. Sterile to sterile, and I'm ready to go ahead and begin the procedure. Okay, I want to now commit my non-dominant hand to remove this oxygen and to place this. Make sure they don't touch. My sterile hand doesn't touch my non-sterile hand. There we go. I'm going to go ahead and test the suctioning by suctioning some sterile water. There we go. Now I'm ready to begin. I want to advance my catheter until I feel resistance. There we go. I keep advancing until I feel resistance. Once I feel resistance, I can go ahead and intermittently suction and twist around for 10 seconds and then pull up. And then I'm going to look at the secretions, make sure they're viscous or thin. In this case, they're thin. And the color, suction some sterile water, and based on my nursing judgment, based on his secretions, if he needs another pass, I'm going to hyperoxygenate him for a minute. Put it back on. Wait a minute and suction again. I will repeat the procedure again and remove the oxygen and see if he needs another suction. But in this case, he doesn't. He's all good. His oxygen saturations are up. He can cough better. He has his oxygen on, and I think the skill is complete. I'm going to go ahead and just dispose of the equipment by twirling around my hand. There we go. Okay, now I want to be careful right here. There we go. Now 2 fingers underneath. I'm going to be careful. And I want to quickly dispose of this in the biohazard. Hand hygiene. And at this point, I would remove my PPE, remove my gown. Hand hygiene again, remove my mask. Get a set of lung sounds. See how they sound. Look at my patient's tolerance by asking him, okay, Mr. Brown, how did that feel? Document his tolerance. Document the lung sound. Document his vitals, his pulse ox, the secretions I suctioned, and how many passes I made. I also want to put him back in the Fowler's position or high Fowler's. Give him safety by putting the side rails up and giving him his call light. And at this point, I want to document all that, name, date, initial, and I want to say skill is complete. Thank you.